As BC continues to grapple with the need for nurses, the province says it wants to remove barriers in hopes of bolstering the healthcare system.
Well, right now, candidates in this scenario are waiting 3 years to be granted registration. Our goal is to bring it down with these reforms to between 4 to 9 months.
Premier David Eby says for nurses trained abroad, the province plans to spend $1.3 million to streamline the licensing process.
Whether a nurse was trained in our province or not, we're ready to welcome those who are ready to care for British Columbians.
This pediatric nurse from the Philippines says she managed to navigate the system, but others have not.
In the unit I work now, I am the only IEN. However, a lot of our clerks, our care aides, were all nurses back in their home countries.
For Canadian-trained nurses, the government will offer financial support of up to $4,000 to cover applications, assessments, and eligible travel costs for current nurses to re-enter the system. There will also be up to $10,000 in bursaries for any additional education they may need to get back to work. Despite nursing shortages, the province is opening hospital emergency operations centers to help deal with the highly transmissible COVID variant XBB 1.5. Health Minister Adrian Dix says 10,000 people were in acute care across the province as of Thursday, up 6% from New Year's Eve.
Historically high levels of people in hospital, that we're facing the most challenging period in healthcare, which is typically January and February. We're in the midst of a respiratory illness season and a pandemic.
The president of the BC Nurses Union, meanwhile, says vacancies abound.
As of this past spring, 5,200 vacancies here in BC, and by 2031 we need 26,000 new nurses.
For its part, the province says 2,000 nurses are in the registration and assessment process now and could be working in 90 days. Mira Baines, CBC News, Vancouver.